Welcome to Understanding CK Levels. This section is entitled An Introduction to Creatine Kinase Levels with Dr. Bo Lee. Parent Project Muscular Dystrophy is grateful to have this education provided by Dr. Bo Lee. Dr. Lee is a pediatric neurologist at the University of Rochester in Rochester, New York, who specializes in neuromuscular disorders, including Duchenne and Becker muscular dystrophy. What is creatine kinase?
So, creatine kinase, sometimes referred to this as CK for short, is an enzyme that's normally found in lots of different tissues in our body. But the highest amounts are found in our muscles and our heart. And an enzyme basically, what it does is speeds up different chemical reactions in our body. And CK specifically functions as an enzyme that helps supply energy to our muscle cells. So normally a small amount of CK is also present in our blood, so we can measure this. And if it's elevated, that often indicates that there is muscle damage or stress going on.
Why is creatine kinase elevated for people with Duchenne and Becker muscular dystrophy?
So when we check a CK level, we are measuring the amount of CK in the person's blood. And in Duchenne and Becker muscular dystrophy, the body is lacking a protein called dystrophin, which is really important for the integrity and stability of the cell membrane of the muscle cell. And the cell membrane, you can consider just sort of the covering of the cell, and it balances what goes in and comes out of cells. And so when the cell membrane loses the stability or sustains damage, like it does in Duchenne, CK will then leak out of the cells and into the blood. And so we can detect that at higher levels in the blood.
Is CK elevated for every person with Duchenne or Becker?
CK has a very good sensitivity for Duchenne and Becker, meaning that it should be elevated in almost all people with Duchenne or Becker, but it's not a perfect test. And so it can depend on many factors, especially including at what age the lab is checked. In general, though, a normal CK in a young child is fairly reassuring against a diagnosis of Duchenne.
Are there reasons why CK can be elevated for people who don't have muscular dystrophy?
Yes, so there are many reasons a CK can be elevated in a person. Some common things include things like trauma or other stress to the muscle. You can have inflammation of the muscle that causes elevations of CK, medications that can elevate CK, and really any severe illness and even strenuous exercise can elevate CK. And of course, there are other non-DMD, BMD muscle disorders where CK could and can be elevated.
Do people with Duchenne and Becker have elevated CK every day of their life?
So CK levels will fluctuate to some degree, both in the short term and the long term. And we've learned that patients with Duchenne, CK tends to be maximally high or elevated in early childhood, and then kind of gradually trends down over time, correlating with increasing age and decreasing motor function. So the older you get and the worse your motor function is, your CK does come down.
Is that experience where someone's CK levels decrease with age and as their motor function declines, is that because they're using their muscles less, so there's less damage?
Um, a lot of it has to do with the fact that there is less normal, healthy muscle tissue as you get older. And a lot of that muscle is then replaced with other things like fat and fibrosis. And so there's less of that to be released into the blood.
Sometimes test reports refer to other terms. We see terms like CPK, CKMM, or CK total. Are these different from each other?
So this is a really good point, and can be very confusing. But CPK stands for creatine phosphokinase. It's used essentially interchangeably with CK. The nomenclature is probably slightly more specific to the chemical reaction that the enzyme is responsible for, but CK and CPK are synonymous, and we use them kind of interchangeably. When you see CKMM, that refers to the type of CK. So CK has a few different forms. Sometimes we call these isoforms. And different tissue types have different levels of expression of each isoform. So for example, CKMM is mostly going to be in your skeletal muscle and in your heart. There's also CKMB, CKBB, and then the total CK is a sum of all of the isoenzymes. So when you have an elevation in any individual isoform, that's also going to reflect as an elevation in the total CK. But seeing which form of CK is high can help you figure out whether that extra CK we're measuring in the blood is coming from the heart, the muscles, or the brain.
Do you think there's anything in particular that families need to understand? Let's say they're told a CK level. Do they need to ask if it's CKMM or total? Is there something important they need to understand about that?
I think that most of the time clinically it'll be a total CK. Um, But we do know that things like CKMM are going to be used for certain newborn screening protocols. And so it might come up, but a lot of the time we are thinking about CK total or just CK. And that is a reflection of all of the isoforms in combination.
Is CK elevated for every person with Duchenne or with Becker?
So CK is a very sensitive marker for Duchenne and Becker. And so that means that we expect it to be elevated in all patients with Duchenne. It's not a perfect test and sometimes can depend on other factors like what age the lab is checked. But in general, a normal CK in a young child is fairly reassuring against a diagnosis of Duchenne.